When it comes to our healthcare systems, local public health agencies should be leading the shift from a treatment model of health to a prevention model. This advice comes from Dr. Jeffrey Levy, Executive Director of Trust for America's Health, who addressed over 100 Georgia public health professionals at the State of Public Health Conference held at the University of Georgia on October 6th. Levy urged public health professionals to begin by partnering with local healthcare systems to guide change.
That's the starting point, creating a partnership between public health and the healthcare system, and public health opening the door to understanding the broader community.
And each community is different. Levy points to efforts in Seattle, Chicago, San Diego, and Michigan, where local agencies approached improving public health in ways that made sense for their communities.
Different approaches, some very centralized, some very decentralized, have reflected leadership by the public health agency in creating coalitions of support.
For example, Hennepin County, Michigan's health department partnered with other local social services to provide care at all levels of need.
In Hennepin County, what they've tried to do is bring together the healthcare system and the social services system and create the data systems that will allow the assurance that people, no matter what their initial service need or point of entry is to the service system, will get the full range of health services and social services they need.
No matter what approach a community takes, says Levy, the key is to think about interventions that improve a person's life overall rather than a single disease.
So, for example, we know that physical activity and nutrition are incredibly important, not just for addressing obesity, but also heart disease and diabetes. And, being more physically active reduces depression. Kids who are more physically active are less likely to get sexually transmitted infections. It goes on and on and on. And yet we think of our interventions disease by disease.
We need to meet people where they are, Levy says, if we hope to address the causes of poor health rather than simply treat it. For Graduate Newsroom, I'm Lauren Baggett.